Hey team, I just kind of want to talk to you guys about what to do when patients reject treatment. So for example, lately I've been having a lot of people that are not wanting fluorides, and this is a thing that is happening. So I just kind of wanted to talk about it and just get it out there. There's a lot of stuff, a lot of information about fluorides not being good for people that our patients are seeing. Now, I'm not going to get into whether this is the truth or not. I know we've all seen fluorides work well for our patients, but some do not believe in it, and some believe that it is really bad for you. And I've been having a lot of patients reject it lately, and that's okay. They don't have to believe everything that we believe, and we don't have to try to make them believe our way. So I would just document in the chart that, the patient declined fluoride. Same thing with x-rays. Every once in a while, I'll get a patient declining x-rays. That doesn't happen too often, I feel like, for me. But if so, I just ask the patient the reason why. I say, just for my documentation, can you just tell me the reason for it? Just because, we're supposed to take them in certain increments, just for standard of care. And so they just say, oh, well, I just don't want them. I don't want the radiation, or I'm in a hurry. And so I just write that down. Patient in a hurry, didn't want x-rays. Same thing with SRP. Just the other day, I was not requiring, I was recommending that the patient have SRP as the best option. Now with temping, I feel like that doesn't happen very often because we're just seeing the patients and, their hygienists are taking care of them, and we're just, going along with the treatment and just kind of filling in while the hygienist is gone. But in this case, the patient hadn't been there for like 3 years. So he was coming back and he did need SRP. But he didn't want that. And so you just give them the options. Here's option number 1, you have SRP, or you can come back more frequently. You can come every 3 months, every 4 months, or you can do nothing. And I just chart that in my chart that I gave him these options. Patient chose, and in this case, the patient chose to come back every 4 months. Patient chose to come back every 4 months. So we just document that we gave him the options and what the patient chose. They don't always have to choose what we think is the best option, and that's okay. We can still love them. We don't have to get crabby about it. We don't have to have a chip on our shoulder about it. We can still love the patient and treat them kindly, etc. So I hope that helps. Tell me what you guys think. Tell me what you guys have been hearing about fluorides and all that fun stuff. I'd like to hear your comments too. All right, over and out. Thanks for all you do. We appreciate you guys.